But as New York is ramping up its hospital capacity, Washington State is kind of the good news story in the country so far. If you look at this chart of coronavirus deaths, you see the difference between New York and Washington is astounding. New York is on a far worse pace than Lombardy, the hardest hit region of Italy. While the closest place to Washington is Daegu, South Korea, where they managed to curb the spread through early action. So that one good news look into the future of our whole country right now, that is in Washington. Governor Jay Inslee, Seattle Mayor Jenny Durkan, and local government took things into their own hands very early in just about every way. They ramped up testing on their own. In fact, one of the folks there tested against FDA guidelines. They were out front on the CDC guidelines. They did the things locally that you should do in the absence of any sort of federal guidance or management. And they are a success story so far. Joining me now, one of the leaders responsible for that success story in Washington State, the mayor of Seattle, Jenny Durkan. And Mayor, I'm sure it doesn't really feel like success there. So let me first start by asking how you and the city are doing right now.
So, Chris, I agree. We are doing better, but this is going to be a long haul. And my number one concern is for the health and safety of the people of Seattle and this region. I've got to give Governor Inslee, Dow Constantine, our county executive, and the mayors of the other cities. We acted quickly and we acted together. And we knew that fast action meant that we might be able to protect our healthcare workers. We've gotten some good news reports just this week on how we're doing on that. But I also want to send the message, as well as we have done, we're in this for the long haul. And people have to understand that this is going to be weeks and months, not days.
On that good news, I saw some reporting about some modeling coming out of universities in the Seattle area about the transmission rate dropping fairly dramatically. It's now been, I think, Seattle sort of went into a lockdown almost earlier than anyone else. And the transmission rate has responded, has dropped dramatically. Is that right?
It is. And we just, we were able to take action very quickly. And if I were to say anything across the country, it's take early action. We have seen now our transmission rate at the beginning of this outbreak just a month ago was at 2.7, which meant that for every person infected, almost 3 people got infected. We've driven that down now to being 1.4. And mobility is even more. 90% of the people traveling into Seattle are not traveling here anymore. So we have cut that mobility and the social connections. The physical distancing is critical to cutting the transmission of the virus. The only way it can transmit is if people are close to one another. And the only way you can stop that is to take really drastic actions. And it has taken a heavy, heavy toll here. I mean, a month ago, Seattle was one of the boomingest economies anywhere in America. We had more cranes building buildings. We had day after day, we're announcing new restaurants, new stores, new work. And now it's shut down. And the people hurt first were those people that were at the lowest parts of the economic ladder. So we've been really trying to direct money to our workers and our small businesses to give them some resilience to make it through this. But I want to urge 2 things. One, every city and county and state has to act as one and act quickly, because if you wait, it will be too late. And 2, we can only do so much. We need the federal government, and we need to have concerted action on the federal government's part. I'm very thankful to the bill that Congress passed. We got to get that money into workers' pockets and small businesses' pockets as quickly as we can. Thankful that our delegation here in Washington State worked really closely with us to ask us what we needed to get through this and come out of this. But we're all in this together. We will get through it. But every one of those numbers is a family and a life that has been upended. And we can't lose sight of the human toll that this is taking.
One of the paradoxes of this, and this refers to something you said early on, right, which is that the idea of flattening the curve means spreading the growth of the infection out over a longer period of time so you don't spike and surpass hospital capacity. But it also means the long haul. I mean, how are you telling your constituents, and how are you thinking personally about what this timeline looks like in the city of Seattle, which in some ways has gone first?
So first is, when we have this kind of good news, we have to also remind people we're still just at the beginning here. We're probably not even in the middle of it. By flattening that curve, that just means we're getting to the point where we won't overwhelm our hospitals. But it means we're going to have this pain longer. And the lack of social connections that are so important to our society and the damage to our economy. So we talk about it in terms of being a marathon. I know that sounds trite, but we're just in the early miles here. And building the resilience in is going to be critical. But Governor Inslee had a good point when I talked to him this weekend. He said, I'd like everybody to tape a picture of a nurse to their front door or to their car and ask themselves, is it worth that nurse's life for me to walk out of my house right now? We've got to do what we need to do to protect those frontline workers, our first responders, our healthcare workers.
Mayor Jenny Durkan of Seattle, I really appreciate you taking time tonight. Thank you so much.